Hi, I'm Julian Lob-Levyt. I'm the CEO of the GAVI Alliance based in Geneva, Washington.
Okay, so what is GAVI and what is unique about it?
GAVI is there to make a huge difference to children's health. We were created 10 years ago to roll out vaccines, life-saving vaccines that you and I take for granted in the rich part of the world, but were denied in the poorest parts of the world simply on the basis of their cost. And it's to get it out to those poorest children, and as many of them as we possibly could. And we were designed as a very unique public-private partnership to use the best of the public sector, the best of the private sector to really get the job done.
Okay, could you tell us a little bit which organizations are involved?
Yeah, we have an alliance that composed of WHO, UNICEF, the World Bank, the Gates Foundation is a major supporter, governments in the north and the south, industry, civil society, but interestingly our board is also has a large number of private sector individuals that bring expertise in finance, in marketing and different skills that you need in this new world.
We learned that GAVI has a 10th birthday now. Can you tell us a bit about what GAVI has achieved over those years?
No, you're quite right. We've gone out to the childhood phase. We're, I think, struggling through adolescence, but we've had tremendous success. Different ways. We work in the 70 poorest countries in the world. In those 70 poorest countries in the world, 80% of children get their 3 doses of vaccine by the time they're 6 months old. That's a tremendous success story that we don't tell well enough. We've vaccinated 250 million children now across the world, and with GAVI support, countries have prevented 5 million child deaths and adult deaths too.
That's impressive. So there are hundreds of thousands of One supporters all over the world who are passionate about fighting poverty and preventable disease. Do you have a message for them?
Yeah, no, that's a really good question. I do have a message. 2010 is a really important year. It's the year when we really need to make a difference on MDGs 4 and 5, on maternal health and child health, as we move through to the New York summit in September this year, when the international community is really going to have its feet held to the fire to make a difference. And we need both the financial commitments and the political commitments to really shift the needle and make a difference. And in particular, I'd like to point out that, which is important to GAVI, is that the 2 biggest killers of children are pneumonia and diarrhoea. And pneumonia kills more children every year than HIV, TB and malaria put together. The good news is we have 2 fantastic vaccines, one against pneumonia, the other against diarrhoea, that we need to now roll out to those high levels of coverage of 80%, which we can do fast, and we need the finance to be able to do that. Unless we do that, we just are not going to meet MDG 4. So that would be my big ask of those supporters out there, is hold all of our feet to the fire, focus on interventions that are going to make a big difference, and let's deal with pneumonia and diarrhoea.